Okay, boys and girls, guess what kind of animal Wacky Benny's making now? I'll give you a big hint.
Is it a dead animal?
I say we put him out of his misery and bring out Emma's cake.
He's so new to this. How's he gonna learn if we stop his act?
You're a sucky clown.
And you're a super duper audience. Hey, that is not okay.
Hey, keep your hands off my son.
Tell him to keep his hands off of me. I can't move my arm or leg.
This'll calm your immune system. You should be out of here within the week.
Mom will be happy to hear that. I've got an internship that starts in 3 weeks.
I take it it's not at a place with a big top.
It's in my stepdad's law office. I know I'm not any good at being a clown yet, but when I do get a laugh, see those kids' eyes light up. That's how my dad made me feel when I was a kid.
You need to hang on to that.
My mom says he was a loving father, but always broke and always on the road. This is a stupid way to make a living.
You're 16. Plenty of time to make money. Wanting to build a connection with your dad, pass on some of the joy that he gave you, that's not stupid at all. Oh, I got it.
Is this because of the medication? Is it normal?
It's not normal, and it's not Sjogren's. Dr. Park is searching the registry. Transfusing his platelets will keep him healthy while we wait.
You sure there's no one on the father side of the family? If one of them's a match, that'd speed things up a lot.
His parents died young. He was an only child. There's no living relatives that I know of.
Something will turn up soon.
How soon is soon? Will he miss a lot of school?
I'm actually thinking of just getting my GED.
How do you expect to get into a good college?
I'm gonna take classes on magic, juggling, and try to make a go of this.
Ben, you keep your grades up, you can do anything in the world.
Like what? Work in some boring office? I mean, do you think my father would have done that for 10 minutes?
You don't remember your father. You don't know.
I want to build a connection with him. Pass on some of the joy that he gave me. My back hurts.
He's dropping.
You have to go see him yourself. He wouldn't even come to the door a second time.
Okay, I'll drive over there.
It's a pleural effusion.
He had a bleeding problem earlier, must be bleeding into his lungs. Except there's no blood. What does that mean? It means you don't have to make that drive. The problem isn't his marrow, it's his liver.
I can't believe I have cancer.
We caught it early. You should be okay.
I could die. I never went anywhere, did anything. If my father had lived, everything would have been different.
Your mom and stepdad love you. They've given you a great home. That counts for a lot.
He's crashing. Everything's shutting down.
Renal failure, lung failure, heart failure, all before we started chemo.
Burkitt's lymphoma is fast moving, but not this fast.
No rush. ICU stands for take your time in Latin.
Multiple aneurysms.
That would mean that every symptom after his TIA was a coincidence.
Cholesterol emboli?
Bingo! Fits perfectly. Check the file, confirm that we did major abdominal surgery on him, then completely forgot about it.
House.
Hello?
What the hell are you doing here?
I was told this might be my last chance to see my son.
You had no right. This is none of your business.
I called him. This man's Ben's hero. Let him spend 5 minutes together.
No, get out of here.
Wait. You sexually molested your son. Your walk, tabes dorsalis. You have late-stage syphilis, which you gave to our patient, presumably 12 years ago, which also explains why Mom is not big on family reunions.
I shouldn't be here.
We tested him for syphilis. He was negative.
After 12 years, the active infection would have died down everywhere except the arteries in his brain where it could hide out from our tests. When that 6-year-old heckler punched him in his juggling pins, kicked up the dormant bacteria in his pelvis. The immunosuppressants we gave him sent it into overdrive. The antibiotics we gave him actually started destroying the syphilis. Like pouring water on a fire. It led to a trail of toxic smoke and ash. Made his immune system overcompensate. Severe Jarisch-Herxheimer reaction.
Is this true?
Yes, Jarisch-Herxheimer is real. It sounds silly, but... Oh, you mean the right.
I found stains on his clothes. He didn't understand. And he didn't seem traumatized. I kept trying to talk to him, but before long he'd forgotten, and he seemed happy and he seemed normal.
So you made Daddy go away and you made sure Junior had no reason to go looking.
I was just trying to protect him. Like I should have done from the start.
Penicillin and anti-TNF antibodies. You'll be fine. Apart from the whole daddy rape thing.
What was wrong with me?
It's called syphilis.
You can get that without having sex?
I didn't tell him.
Your heart said he needed to know. Your brain knew he's better off without it. Following your heart is easy. Following your brain is tough. Especially after years of following that much smaller third organ. That's why all parents screw up all children.
Dr. Hall said incoming ×3. 1, 2, and 3 are all open. Desmond.
15-year-old male, extremely combative, trashed our ambo on the ride over. I'll kill you! I'll kill you! No way to get vitals, managed to stick him with 5 at Versed, but no effect. Looks like PCP maybe got 2 more in the ambo behind ours.
10 of Haldol, I am. The other 2 like this?
I think they all took the same thing.
All right. They're here. Wheeler, stay with them, Clark with me.
Okay, watch this. Got it.
Easy night. She jinxed it. Cesar.
15-year-old boy. He sees on the ride over, but responded well to 5 of Versed I am. We intubated en route.
All right, ABCs. Check the tube placement, get a quick exam, Ativan drip, then send him for head CT.
Got it.
Okay, watch the line. Coming back.
Courtney?
Gave her 5 of Versed in the ambo, but didn't stop the seizing. Have her on oxygen, but couldn't give her much else.
All right, Maggie, CBC, CMP, and blood gas on all 3. Send blood and urine for a tox screen. Copy that. On my count. 1, 2, 3. Let's get an IV in and an MPA.
Yes, doctor. All right, I need an 18 catheter.
On it. Need an NG tube.
All right. 90/60.
Heart rate regular.
Okay, let's move him.
Okay, here we go.
Just protecting her airway. Thank you. Okay, we're in.
Stat of 97%.
All right, let's take advantage of her postictal state and get her head scanned. Hey, bring Ativan with you.
Watch your back.
Look alive, Dr. Halstead.
It's a broad presentation. Are we sure they're all on the same thing?
Until we get tox screens, who knows?
Hi, I'm Dr. Wheeler. Do you know where you are? Do you understand? Can you tell me how you got here?
Grab him.
No! Get away!
I got you. 5% 10, Haldol, iron.
I'll kill you!
Get the restraints back on this kid.
What's wrong with him?
Delirium can sometimes be a sign of kidney failure. Happens with these drugs.
The kid's parents are on the way in.
There's nothing good to tell them.
Hey, sorry to call you back in.
No, I'm fine. Tate's not, though.
Oh.
Girl, my work is a problem for him. I really thought we were past it, but he won't let it go.
Well, every couple's got stuff they got to deal with. You're needing too.
No way I'm gonna stop working.
Dad, I'm sorry.
Rudy.
BUN is 130. Creatinine is 6.
Look at his output.
Renal failure?
I'm afraid Rudy's going to need emergency dialysis.
Put a temporary dialysis catheter in his left subclavian.
Okay.
I'm sorry, folks. We're gonna need you to wait outside.
Thank you, April.
Yes.
Are you in?
No.
Must have hit the lung. Pneumothorax. Let's get a chest x-ray.
Oh, no.
Let's see if this lung is down. Yep, it is. Now I'll do the line.
I don't know what happened.
Hook up your chest tube.
Really, I thought I had it.
Hey, it happens. The lung will be fine. You'll get it.
How's my son?
Dr. Halstead will give you an update.
Well, the boy stopped seizing, but he's got cerebral edema.
Rick, that's his name.
Hopefully mannitol will bring it down. When Rick wakes, if he wakes, we'll do cognitive tests, but I'll tell you, he's gonna have deficits.
Deficits?
Yeah, like walking, talking, bladder and bowel control.
And the girl, Jana?
EEG shows she continues to have subclinical seizures. We had to put her in a barbiturate coma. Possible she doesn't wake up.
Never wakes up. Renal failure, deficits, coma. Wheeler, they're just kids.
What's the matter with you? Wheeler, are you drunk?
Their lives are over.
Hey, are you drunk?
He detox.
6-year-old with a nosebleed and breathing problems. She was born with a rare mutation of AT.
Emily has a unique variant on both of her ATM genes. Her disorder mimics AT, but not all of the symptoms.
This is Dr. Elizabeth Lawson. She's a developmental geneticist attached to JHU and an expert on the girl's condition.
Elizabeth Lawson. Emily Lawson.
I'm here as a doctor, not a mother.
Nosebleeds and breathing problems are common symptoms of ataxia telangiectasia.
You could just be seeing a natural
It's
progression.
not. AT patients have a life expectancy of 20 years. Emily is only 6. It's something else. I examined her lungs 2 days ago. They're functioning normally.
It says she fell off a carousel, head trauma.
The diagnosis was easy. I wouldn't need you people. I'm here because, according to Eric, you're the best.
We are. Have you considered Wegener's granulomatosis?
It's a good fit. But she can't have x-rays. AT makes her hypersensitive to ionizing radiation. I'll get her prepped for an MRI.
She knows more about her daughter's genetic condition than any of you. She'll be an asset.
Or she won't, Eric.
This isn't a request. Use her.
How you feeling in there, Emily?
Good, I guess.
Something wrong?
I was only pretending to be asleep. You think that's dishonest?
That's
My daughters do that too, but they know that sometimes when it seems like mommy and daddy are fighting, it's really only because they're worried about you.
And does your wife ever want a divorce?
No, everything's fine at home. Hold still now, no more talking.
What do you think of her mother? She called her daughter the patient.
If my kids were born with an expiration date, I don't...
Ow! Ow! Owie!
Where does it hurt?
Where's my daddy? Where's my daddy? Ow! Ow!
Kidney number 1 looks good, which means we'll probably take the biopsy from 2.
Hey, you're doing great. Brave as always.
Pretty cool, eh? Wanna try?
What's wrong?
My chest hurts.
Definitely not her kidneys. Kidneys are fine. I don't think we're looking at side effects from the Lex-2.
She's prone to respiratory infection, pneumonia.
No persistent cough, chills, or excess sweating.
What about a pulmonary embolism?
Fitz coughing up blood, but a clot? From what?
Bruising from when she fell off the carousel. Contusion damages a deep vein, causes a clot. Piece breaks off, travels to her lungs.
We need to get her on heparin now. Another embolism could cause a heart attack or a stroke. What's wrong? Is it Emily?
Sort of.
You can't do this!
I'm taking her to Mercy. Everything you people have done has just made her worse.
You don't have the right. We have joint custody.
Where was my right when you were treating our daughter like a lab rat?
She'd be dead if I hadn't.
Stop it! Your daughter deserves better than this.
It's okay, sweetie.
Mommy and I are just gonna talk, okay?
Let me get some candy. I think it's Lyme.
I would have seen signs of that.
Not if the Lex-2 was keeping it in check.
Well, we live in the city. We don't have pets. She's never even been in the woods.
Yes, I have. With Daddy.
I should have told you, but I know how you feel about it. I grew up hunting with my dad. I wanted to share it with my daughter, at least once.
We only took pictures. You don't need to be mad.
Maybe we should step outside.
No. We can't protect her from everything. I assume you'll need a lumbar puncture to confirm.
Do you think my parents will get back together?
I don't know. I'm sure they love each other, but
They only fight about me.
That's because they care so much.
So maybe when I die, we'll get back together.
Emily, what's wrong?
I can't move my arm.
arms up for me.
What's happening to her?
She's having a stroke. A primary heart tumor. The swinging motion of the myxoma intermittently blocked the flow of blood through the right atrium. Inflow blockage stagnated the hepatic vein, which clotted and caused liver failure. Outflow blockage caused the Raynaud's phenomenon and stroke. Pieces of the tumor broke off and lodged in the lungs, causing Emily's breathing problems and the coughing blood. We'll remove the tumor surgically, and hopefully the biopsy reveals it's benign. The tumor was benign.
And we were able to remove all of it.
Does this mean I'm not sick anymore?
No, honey. The tumor didn't cause your genetic condition. You're still sick.
We never let that stop us before, right? So what do you want to do when we get out of here?
You been to the aquarium? It's pretty cool.
Can we go, Daddy?
You bet.
Me too?
Can she come with us?
You know Mommy never has to ask.
Have you talked to House? It's 6 a.m. He won't be in for a few hours.
I keep a roll of quarters in the car.
I just turned in my log, and guess what I saw? There's an opening in the diagnostics department.
House wants an intern?
He's never had one before.
You gotta figure he doesn't want an intern. He wants you.
Our patient is Kendall Pearson, 16-year-old aspiring pirate.
She's a Canadian kid who's trying to be the youngest person to sail around the world.
She collapsed yesterday during a practice run. Luckily for us, cameras were there. Corporate sponsors want us to check that she's seaworthy before the clock strikes. You're too old to set a record. Gives us 3 days. You've still only got one, right?
Last day as a student. Could be simple dehydration. She told the Coast Guard she had felt dizzy.
Pulse and BP were normal at the time of the rescue. It's not dehydration. What about your internship? You sign up this morning?
Actually, I'm still deciding. Maybe she had a seizure, and that's what caused her collapse.
Coast Guard report says no sign of head trauma.
What about her back? Look, right before the collapse, she hit the small of her back on the railing. Damaged adrenal glands caused adrenal insufficiencies, which caused the collapse.
Nice. Blood draws every 15 minutes for 4 hours. Let's track her cortisol. Masters, there's no hurry. There's no wrong choices. At least that's what they tell people who make crappy choices.
What's with the sudden interest in her future?
You know, a blacksmith who spends this much time hammering out a new blade from raw jello. It's curious about who ends up wielding it.
No reason to be curious unless you're interested in wielding it yourself. You want her to intern here.
And you're considering this?
Before I make my decision, I still have one more LP I need to get, so I'd like to go to the ER.
13, why don't you take Masters to do the blood draws? You can remind her about all the perks of working for me. You want the job or not?
After careful consideration, I have decided to accept your offer for an internship.
Great. My department has a slightly different procedure log.
You forged the last one. I only did 9 LPs.
Do you know how to do an LP?
Of course.
Do you know how to do 9 LPs and say it was 10? It's time to grow up. Turn that in, job's yours. Stop staring blankly and go. No doubt something horrible has just happened to our patient. Do you happen to stop and give 13 an LP? 13's stiff gait, small pupils, and the raging headache she's hiding gave you away.
Yes. And I still broke a rule.
My rule. I told you to defy the man, not this man.
Why is it so wrong that I don't like to cheat?
Can we go?
No. Not liking it is fine. Not doing what you don't like makes you an 8-year-old. Wastes your potential.
You want me to be like you, it's not gonna happen.
That's the last thing I want, because then neither one of us would be exceptional.
You think I'm exceptional?
Not anymore.
I can do my job without compromising.
No, you can't. So I'm not gonna let you. Internship's gone. It's time for Masters to say goodbye. Enjoy being a surgeon. You'll be fine.
Can someone take the retractors for me?
Not really.
I have to use the bathroom.
I know you're a rookie, but you gotta be kidding.
I'm not.
It can wait.
I'm gonna have an accident.
Next one in line, grab it.
What's wrong?
Hypotension, low cardiac output. Float the swan.
Don't you have your own surgery?
I took a break. I told them I had to pee.
Lie. A small one, but it's a gateway lie.
I care about the patient.
Another lie. You care about being exceptional.
I told her dad I was gonna take care of her.
A third lie. Welcome to the slippery slope.
RA is 8, equalization of pressures.
And she has restrictive pericarditis.
Add that to a calcified pineal gland.
When is a calcified pineal gland not a calcified pineal gland? I realize technically it's never, but
When it's a granuloma. It's Wegner's. We should start her on steroids.
But she had a high CK. Wigner's wouldn't explain that.
Dehydration does.
Yes, but the calcified pineal could be sarcoidosis.
you had me at I had to pee. But 13's right. Start her on 3-fold immunosuppressants. Masters, if you want to fight me on this, fill out a consult form so you can stick around. Welcome back.
I'm not back. I'll just be staying for this case.
Ready cardiac arrest. 3rd-degree heart block. Likely paraneoplastic syndrome. Need to get into the OR, pacemaker, and plasmapheresis.
What's going on? Cancer is causing her heart to slow down. We have to get her to the OR and treat her. This is what I was worried about. If this had happened at sea, she would be dead. Oh my God. We need you to sign the consent form. Authorize us to amputate her arm.
Subclavian access established.
Temporary pacer ready.
Don't need it. Push calcium chloride. It'll fix the heart block. Bradycardia was me.
You did this?
Parents signed the consent form. Amputate her arm. You had a cardiac episode that required us to bring you into the OR. That crisis resolved, but... What did you do? What did you do? During surgery, we found cancer in a lymph node in your neck.
So you cut off my arm?
Cancer was already spreading. It had to be done.
I told you I didn't want this.
If we had waited until after the sale was over, you would have died.
That record, that was everything.
It wasn't everything. You have a life, a future.
You weren't supposed to do this. How could you?
Because we love you.
I hate you. I hate both of you.
Okay.
My arm.